all of a sudden things were started to move. The general practitioner made an appointment for me. This was on a Friday. Made an appointment for me to see the specialist on the Monday. The specialist sent me for ultrasound and a CT scan and blood tests. They all came back, and on the CT scan one could see, and the ultrasound one could see the malignant tumors. There were 2. I was then prepped for a cystoscopy on the Friday. I went into Westmead Hospital, and I was put under an anesthetic, and they put in the cystoscopy and cut out the 2 tumors and sent them off for biopsy. Everything was fine. I went back a week later. The doctor said to me, I have good news and I have bad news. He says, the good news is I think I got most of the if not all of the tumors out. The bad news is it's a very aggressive high-grade cancer. He graded it TA high grade. He suggested we have another cystoscopy where he wanted to take further biopsies to confirm that he had got all the cancer out. I thought, well, this sounds good. He's confident he got it all out. This should be just a formality. I went into Nepean Hospital, again under full anesthetic. I woke up. He came in and said it was very red inside. We'll wait for the biopsy, and I was free to go home the next morning. I waited for the week, got my results, walked in, and he said, I'm sorry to say that the cancer is very aggressive. We can't pinpoint exactly where inside the bladder, but we need to start BCG as soon as possible. And that is in fact where I am at the moment. I start my BCG on the 19th of September. I have a series of 6 scheduled procedures, and following that, who knows.
He gave me some options, either surgery with chemotherapy or radiation with chemotherapy. We were given advice to go to certain people to get of which way to go, and I guess originally we went to see the people that were going to do the radiation, and I guess I was quite excited that they said they could do it. But after looking into it, there could be many symptoms or many complications with the radiation. So I then got some advice that they would do the chemotherapy with removal of the bladder. I then looked into what type of bladder removal, whether to have the stoma bag or the Neobladder. This took probably a month of my wife and I, of lots of phone calls, lots of appointments, and decided to go the harder way with the Neobladder, and I've never looked back. I had the open normal surgery where they removed the bladder, the prostate, the lymph nodes, and I think my appendix as well. The chemotherapy I didn't do too bad with. It went over 12 weeks. You have it once a week for the first 2 weeks, then the third week is a break. I did have a bit of a reaction towards the end, which was quite serious, so we stopped chemotherapy 1 week before the end. I didn't want to risk any more serious complications, but generally didn't lose any hair. Felt a little bit headachy, sore, but not too bad. Surgery was 3 months ago. It was Neobladder surgery. It was I was supposed to be in hospital for 8 days, but through some complications, not particularly with the Neobladder, but with blood disease, heart rate going up type of thing. I was in there for 23 days, so it has been hard. It's been now 3.5 months since surgery, and I'm feeling nearly back to 90% of what I was.
Anna's always been quite spiritual in how she is. It's part of her character and what's so lovely about her. And as well as the medical profession, she did a lot of complementary therapy, and being a nutritionist, she knew quite a lot about this, and she knew a lot of people. So she would have acupuncture, massage. She had Chinese herbs. We would go on. She did meditation, which was became quite important to her. I think all of the complementary therapies that she did kept her really quite balanced, and it was a nice mix between going through what was a very aggressive, formal medical path, balanced with a lot of the complementary therapies that she did, and she enjoyed, and that was something that she felt comfortable with.
In terms of choices for the treatment, my eldest daughter's a doctor, my wife's a registered nurse. I trust the medical profession, and they were very adamant with what my treatment should be. And that treatment was surgery, and to do that surgery as soon as possible, and not to muck around with it. And they booked me straight away. Yes, in terms of what I've had done in terms of surgery, my original urologist was convinced that the cancer had spread, but he also wanted to know how aggressive the tumour was. And so I had 2 procedures where he goes in, takes a section of the tumour. That happened twice. He has a look around. In the end, it seemed that the tumour hadn't spread, the cancer hadn't spread outside the bladder, so the decision was made after 2 TURBTs, they call them, and needle biopsies and more MRIs and CT scans, that it was time to have the surgery. He was hoping that if it had spread, that I would get some pre-surgery chemo, but he couldn't prove that it had spread, so the decision was finally made in May that it was time that my bladder came out. And we then moved to another urologist in the public system with the blessing of the first urologist, because it was just proving so expensive. We had private health insurance, but the private health insurance couldn't keep up with the expense of the initial surgery under private health. And because it was cancer, I jumped the queue effectively, and it was a complete bladder removal, along with prostate removal, even though there was no evidence of the tumour going through the bladder wall. With men, what they do is they just take the prostate out anyway. There were a couple of lymph nodes that looked as though they might be involved. They weren't sure, but they took those out anyway. It was about 3 days after the surgery, and my urologist came to my hospital bed and said they were 100% sure that they'd got it all, which is a pretty good big call to make. But again, I trusted what they were saying, and he said we won't do follow-up chemo or radiography or anything like that.
Once we had the diagnosis, we quickly realised that there was a huge amount of expenses continually happening. Pathology and all of these radiology scans were very expensive, and we had NIB health cover, and they really only paid a pittance of our bill. And Steve's was in a new business, and we really didn't have much financial backup, and our cash flow was very spasmodic and unpredictable. I was only working part-time night shifts as a nurse, and then I needed to take some time off to help be there with Steve with his appointments and things. And we realising that, and even with our urologist, his bills were huge. And we realising that, how are we going to afford this? So we talked to our daughter, she's actually a doctor, and she said, look, you're going to have to talk to your urologist and say, look, is there any possibility that you can go public, because we can't afford this. So she actually came with us to an appointment and said, look, can you go easy with mum and dad on their bills? They can't pay these very well. And he said, he didn't operate publicly, so he said, but he'd find a public urologist that he was happy to refer us to.
About a week later, I went in for a cystoscopy, where they removed the tumour and they sent it off to pathology. I stayed in hospital one night, released the next day, felt okay, everything was good. About a week later, I went back to the urologist for the results of the biopsy. Well, much to my absolute shock, the biopsy results was that it was a bladder cancer, a muscle invasive bladder cancer, and it was high grade. I was immediately referred to a surgeon for further treatment. About 4 weeks after my initial diagnosis, I had surgery where they removed my entire bladder, uterus, and lymph nodes. I chose a Neobladder option as a bladder replacement. This is where they make a new bladder out of a piece of my bowel, and it's all internal. I spent 9 days in hospital. I had robotic surgery, and I have never looked back. My Neobladder works just the same as my old bladder worked, and I feel great.
He basically at the start went down I was going to have 6 weekly, and then it went to 3 monthly checks of a cystoscopy. I think it was what's called a rigid cystoscopy, the first one, so they could actually remove them at the time if they found any. We had a couple of those, and then we moved to flexible, but for the first couple as well, flexibles, there were more tumours found, so we had to go back and have rigids. And then after about 18 months of going through the cystoscopy cycle, they said you're going to have 6 weeks of BCG therapy. It was once a week getting inserted into the bladder, the BCG dose. I think it was about 3 hours you had to be lying on the bed, and it was like being a turkey basting / rotisserie. You had to be turned, you had to turn very slowly every 40 minutes so it could do all parts of the bladder. Then at the end they took the catheter out, and since then, well, next February I've had a yearly check and next year I'm coming up to 5 years cancer free. I didn't have to have radiation or chemotherapy at all. One of the lucky ones.